Hey, Cat Matlock here at FreeBody, and I'm going to take this next few minutes to explain to you just what a trigger point is and how we get them embedded in our tissue, in our bodies, and then what can we as therapists how do we work to help move this tension or trigger point out of the muscle so that our clients can feel greater ease in their bodies. So we're going to talk about what a trigger point is, how we get them, and then how we can change that pattern in the tissue. So let's get started. This is right from Janet Travell from the Travell and Simons Myofascial pain and dysfunction manuals, the big red Bibles of trigger point therapy. And Janet Travell says that a myofascial trigger point is defined as a hyper-irritable spot. So those places in your clients, in their tissue where you're working along and that feels like a tender spot. So a hyper-irritable spot, usually within a taut band of skeletal muscle or in the muscle fascia, that is painful on compression and that can give rise to characteristic referred pain, tenderness, and autonomic phenomena. So let's break that down. That hyper-irritable spot, you're cruising along, doing some nice massage work in your client, you feel an area that's thicker or maybe just has this long, thin line of thickness. That is the taut band. And typically, the trigger point lives kind of right in the center of that taut band. So as you're honing your palpation skills, you're feeling through your client's tissues, and then you start to find these areas where the tissue just feels thicker than others, and it feels more like there's a length to it, or just kind of a jumbly thickness. That's typically where we'll find trigger points. And this is where it can be really helpful for you to understand anatomy, because in some areas of the body, there are just layers of tissues that always feel kind of thick and ropey. So it's helpful to understand your anatomy and your palpation, hone your palpation skills so you can differentiate between just layers of tissue and actual taut bands with trigger points inside them. So we're looking for a hyper-irritable spot within a taut band of tissue, and that it's painful on compression. So again, you sink into a spot, your client says, oh, yep, that's tender. I like to use more positive words like, is it exquisite? Does it feel special? Does it feel important? So that's the kind of languaging that I use, but we can, it's painful on compression. And it can give rise to characteristic referred pain. So there are points in the pecs, for example, that refer down the arm, points in the scalenes that refer down into the hand, and that can make the hand be numb and tingly. And so there are referred pain patterns that are about the same from person to person. So I know that if my client is having nauseous headaches, that they're probably going to have this spot in their upper trapezius, right about in the center, and that spot causes nauseous headaches that shoot up the neck and around the side of the head. So if I have a client that comes in and says, oh, I get my neck aches and I get these headaches on the side of my head, and I might ask them, do you get nauseous? Yes. And then I know that they have that point. So that's the beautiful thing about trigger point therapy, is that there are these characteristic patterns of pain and discomfort that our clients will experience. And it can feel tender, and it can also create autonomic phenomena, which means it can make your hands sweaty. Autonomic nervous system is fight or flight response or rest and digest response. So if we go into fight or flight, our eyes might get big. We might feel a little nauseous. We might feel a little gripping in the stomach. I've had clients kind of break out into a little bit of sweat. And so we just kind of breathe and help them to navigate those sensations. And hopefully that you're moving very slowly so that you can avoid that as much as possible. So here we have our trigger point definition: myofascial trigger point, the hyper-irritable spot within a taut band of skeletal muscle or fascia that you'll be able to feel, painful on compression, and can give rise to characteristic referred pain, tenderness, and autonomic phenomena. So trigger points are commonly associated with myofascial pain. And with this study, I love this information because it helps you to understand why when you are working with clients and they come in and they say, oh, I have nothing going on. I'm totally fine. My shoulders feel great. My neck, I carry a little tension. And then as you're working in it, they're like, wow, that is so painful. I had no idea I was carrying all of that tension and that pain in my body. These are called latent trigger points, and that in 200 asymptomatic adults, more than half of the females and 44% of the males were carrying latent trigger points. And to me, that's just a place in the body that's working a little too hard, or that given enough more pressure or engagement of the tissue, that tissue is going to become a full-blown trigger point, and then there might be a cause of all kinds of issues coming up for that client. In adult populations with complaints of pain, 86 to 93% had active trigger points. So a latent trigger point will only give its pain referral pattern or create some sort of sensation or tenderness on compression. Latent trigger point only on compression. An active trigger point means that the client is experiencing pain, discomfort, autonomic experiences, referred pain, maybe numbness, tingling sensations, even when the trigger point is not being compressed. And these are the symptoms that your client shows up to you having. Oh yeah, I have this thing in my hip. It travels down the side of my leg, maybe even into my shin. It's hard for me to stand on that one leg. If I'm trying to do some yoga and doing one-legged poses, I can't stand on that one side because that hip is weak. Then I know that their gluteus minimus is wrapped up tight with trigger points. And if I can do all the work that I do to alleviate that pain and discomfort is going to go away. So this is significant. 86 to 93% had active trigger points. So this to me is the key in trigger points and understanding trigger points and their pain referral patterns and how to work with them and how to work with your client and their nervous system is key to helping people to get out of pain. And so that's our goal. So why do we get trigger points? Why do we get trigger points? Well, we have what we want is nice muscle tone. And sometimes our muscles get a little overzealous and hold in tension. So first we want to understand what is the difference between tone and tension. So if I'm contracting a muscle, I'm going to use this example. There's, a string of muscle, and I'm holding one place of contraction, and then this part of the muscle is relaxed. And then I might hold that part in contraction. This part releases. Now this part down the line contracts. This releases. This part down the line contracts. And then this releases, and then maybe this first part contracts again. So the thing is, we can build tone in our muscles by staying strong, doing a little bit of exercise to help build tone in the muscle so that we have a nice flowing contraction through our muscle tissue that is keeping the muscle prepared to do work. And that's what we want. We want that nice flowing tone in our muscles so our muscles are prepared to do work at any given time. Tension occurs when we have this part is in contraction, this part contracts, this part didn't release. This releases, this part contracts, this part still didn't release. This releases, this contracts, this part still didn't release. So this is tension. The rest of this tissue is flowing through tone. This is tension. This is a part of the muscle that is habitually stuck in contraction. It then becomes a hyper-irritable spot in the muscle tissue, and it might be latent. It's only tender on compression where it's like, oh, it's too much. Or if it stays there long enough or holds strongly enough, then it starts to have referred pain and cause discomfort in our clients. So that's the difference between tone and tension. And trigger points are really how our muscles hold tension. When our clients come in and say, I hold some tension in my neck, that means that there's part of the neck muscles that are stuck in contraction. And that's exactly the definition of a trigger point. So trigger points are tension in the muscles. And if you know how to really effectively treat trigger points, you will be able to help your clients alleviate their tension and hopefully build new patterns in their tissue so that their tissue doesn't go back to holding that tension habitually. So what causes trigger points to develop in the muscles? All kinds of things. Living in a human body causes trigger points. We're all carrying trigger points in our bodies all the time. Whether or not they're causing us pain is that difference between latent and active, okay? So we can have an accident or a whiplash injury where the head is jerked around, the scalenes are going to engage to try to stabilize the neck. Sternocleidomastoid is going to get all jacked up when you get a whiplash or have an accident that occurs around the head or the neck. You could slip and fall, and the hip muscles might engage to try to stabilize the femurs in the sockets, and now you've got sciatica types of issues. So any kind of accident or injury is going to cause trigger points to develop because the muscles will contract really strongly to try to protect the joints and to protect the body. If your clients or you yourself are stuck in chronic forward head posture where the chin is forward of the shoulders and the head is forward of the shoulders, or slouching, or a straining posture, new moms carrying a kid always on one hip tend to develop some hip issues and low back issues and quadratus lumborum from balancing that baby up on the hip. So any of chronic postures, when our position becomes a posture, then we can start having trouble because it's muscle memory. Our muscles are trying to develop, our brains are trying to develop, even the chemistry is trying to develop patterns in the tissue so that it's easier for the body to perform its work. The problem is that when we develop muscle memory, sometimes it goes a little bit too far, and then we're holding tension instead of tone. When you're a child, we fall down the stairs or we fall off our bikes, we can still hold trigger points in our muscles from that moment. I could have fallen off my bike when I was 3 years old. I'm sure I did. I'm sure I did fall off my bike when I was 3 years old. And then in my adult body, I could still be carrying some of that tension. That is going to feed the development of my muscles. It's going to inform the development of my muscles so that ultimately I might always want to stand more on one leg than another, which puts me in a posture that then can cause imbalanced tension throughout my body. So it can be just how I carry myself. It can be from birth, a child getting stuck in the birth canal. It can be a child being drawn out if they're born breech and there's this reaching in and trying to grab, or maybe an arm is sticking out. They're pulling the baby out by the arm. If there is a traumatic birth experience, there can be just the cumulative effects of little physical traumas and injuries throughout our lives. It can be repetitive use. I could be hammering all day with my right arm, and then my trapezius, my rhomboids, my rotator cuff muscles, all the muscles, my supraspinatus, all of these muscles are going to be carrying more tension than this side. Right? So how we use our bodies, repetitive use injuries. Also, I think it's important to understand that intense states of stress, worry, and fear can also cause trigger points to develop in the muscles. And this is because when we go into a state of stress, worry, or fear, we signal our brains to go into fight or flight. And when we go into fight or flight, then we increase muscular tension. And when we increase muscular tension, we have a greater chance of developing trigger points in our bodies. And then finally, underlying diseases. It could be arthritis. It could be connective tissue disease, Raynaud's syndrome. It could be Lyme's disease. It can be a host of underlying systemic causes of tension in the muscles. So just something to be aware of. So these are different ways that our bodies create trigger points in our tissues. So here are the 7 steps in releasing trigger points. You as a therapist, honing your palpation skills and then following the step-by-step guides that I give you, you're going to locate exquisite tenderness in a taut band of tissue in the muscle. Follow the charts, follow the maps, have your trigger point charts laid out and follow them. That's where the trigger points tend to gather and live. And I find that most of the time, it's very accurate. So follow the charts and follow the maps of trigger points. Start there, find an exquisite tenderness in the tissue and ask your client, does this feel important? I feel like this might be a tender spot. Does this spot feel special? And if they say yes, then you direct your pressure at 90 degrees and you sink in. You may not be able to communicate with them. They may not feel it until you're sinking into that 90 degrees. Okay, and so then you want to keep up your communication with your client. You're going to slowly sink into the point or pinch it between your fingers until your client says that you've arrived at a comfortable but exquisite edge. Yes, that's important. We don't want it to be the most pain our client has ever felt. If we go into a point and our client goes, that's a little too much, back out of the point, do a little soothing, work with their breath, and then go back. So if a client gasps or their eyes shoot open, right? Back off a little bit immediately because they may have gone into, in that moment, that's a signal that they've maybe gone into fight or flight. And that's going to only increase muscular tension. So back out, give them a little space, soothe, and then go back in 90 degrees to the tissue, slowly sinking in, communicating with your client. Try a slight shift in direction if you're close, but not exactly on the point. They might say, oh, it feels so close. And just start moving, shifting angles a little bit, not even coming all the way out of the point, but just shifting the angle of the direction that you're working in, because our tissues are round and ropey, and it might be that the point is a little bit on the side of that rope instead of right here. Maybe it's a little bit right here. So trying different angles. Hold that point, encouraging your client to breathe, and they're breathing in their bellies. And you're either holding that point and encouraging your client to relax, or you might engage the muscle in some movement. So if I'm working in the pecs, I might stretch the pecs open with a little external rotation at the shoulder, and then engage the pecs by internal rotation. External, internal, external, internal, while I'm holding the points. Engaging the muscle kind of brings the nervous system out of its sleepy state of just being in habit, and wakes up the tissue a little bit more, brings a little bit more engagement of the nervous system into this area, and helps the tissue to shift often quite quickly. Often quite quickly. Sometimes I feel it's going to be too disturbing to my client to ask them to move. This is the intuition that you have to bring working with your own clients. Sometimes having them move, sometimes just having them breathe. Especially if I'm on an edge of tissue that if they start moving, I might slide off of that point. And I don't want to slide off of that point. I want to just be there. And the movement doesn't have to be huge. It's going to be small, especially because it's going to increase the exquisite tenderness that your client is feeling. So once they start moving, they can actually push into a little bit more into the tenderness and back off, a little bit more into the tenderness and back off. So they get to decide how far they go. And it can be very small, just beginning to engage that muscle. And then you're going to soothe. Soothe, soothe, soothe. I often will only work a couple of points and then do some soothing. A couple of points and then do some soothing. And I often joke with my clients, well, I have to do something that feels nice so you'll come back. Because trigger point work is exquisite and exciting, and some of the points are fiery and spicy, and it can feel very like, whoa, especially to a person that hasn't had trigger point therapy before. So work with their breath. Always work with their breath. So you're going to locate an exquisite tenderness in a top band of muscle tissue. You're going to direct your pressure at 90 degrees to the tissue. So follow the curves of the body. So if I'm working on a curve, if I'm up here, I'm going straight down. But then as I come around, if I'm going straight down here, I'm just sliding off. I want to be 90 degrees to the tissue. Locate the top band. Direct pressure at 90 degrees. Slowly sink in. Try a slight shift in direction if you need. Hold for 7 to 90 seconds, and until the sensation diminishes. So your client might say, "Oh yeah, that feels better," and then you don't have to hold the whole 90 seconds. Client just belly breathes, or they do some movement, and then you do some soothing. So that's it. What a trigger point is, how we get them in our bodies. Basically, being human means that we're going to have trigger points, and then the 7 steps to releasing trigger points. So